Welcome to Aditi Info. 16 crore rupees injection. Why the injection is so expensive to treat for SMA? What is SMA? Spinal muscular atrophy is a hereditary disease that destroys the nerve cells in the brain and the spinal cord that control essential skeletal muscles activity such as speaking, walking, breathing, and swallowing, leading to muscle weakness and atrophy. It has 4 clinical subtypes. Type 1. Wernicke-Hoffmann disease, which is also known as spinal muscular atrophy. Type 1 or acute spinal muscular atrophy refers to individuals who have symptom onset prior to 6 months of age. SMA2 patients will show symptoms prior to age 1 year, will sit but never walk. Spinal muscular atrophy type 2 is a genetic neuromuscular disorder that affects the nerve cells that control voluntary muscles. Without treatment, progressive muscle weakness develops in babies with SMA2 between ages 6 and 12 months. Type 3 symptoms of type 3 SMA is mild, appear after a child's first 18 months of life. Some people with type 3 don't have signs of disease until early adulthood. Type 3 symptoms include mild muscle weakness, difficulty walking, and frequent respiratory infections. Proximal spinal muscular atrophy type 4 is the adult onset form of proximal spinal muscular atrophy characterized by muscle weakness and hypotonia resulting from the degeneration and loss of lower motor neurons in the spinal cord and the brain stem nuclei. Why is SMA treatment so expensive? Zolgen SMA, the world's most expensive drug, is used as gene therapy for the treatment of a rare genetic disorder. Spinal muscular atrophy type 1 SMA is a rare genetic neuromuscular condition. SMA is caused by a lack of a functional SMN1 gene. Does Zolgen SMA cure SMA? No, Zolgen SMA doesn't cure spinal muscular atrophy. There isn't a known cure for SMA at this time. SMA is a rare condition that damages nerve cells in the brain and spinal cord. Patients that have completed a clinical trial of Zolgen SMA will also be rolled into a long-term follow-up study where they will be monitored for up to 15 years after receiving Zolgen SMA. Crowdfunding effort. A Bangalore-based couple, Navin Kumar and Jyoti, have taken to crowdfunding on impactguru.com, a crowdfunding platform, to cover the cost of Zolgen SMA therapy for the 10-month-old baby Janish, who was diagnosed with SMA. Mr. Kumar, who works as an insurance surveyor and barely earns 30,000 a month cannot offer the expensive treatment. The couple were counting their baby's milestones after his birth in February 2020. They caught his first smile and his first laugh, but baby Janish never went past his first two milestones. The parents then rushed him to a pediatrician. From there, the baby was referred to a Baptist hospital, said Dr. Anne Agnes Matthew, who has been treating for the baby for last 5 months. So, government should take some steps in getting these medicines free of cost for the children affected by this rare disease. Thank you.